point of decussation. If we were a little bit lower, we would have decussation happening. So here we have the pyramids, cortical spinal tract running through the pyramids, okay? Here, the central canal. With sitting above it, the gracile nucleus. Here's the fasciculus sitting up there. Here's the nucleus. Here's the fasciculus. Actually, you could call this whole thing the fasciculus. Here's nucleus cuneatus. So fasciculus cuneatus sitting above it. So here's the inferior olive sitting down here. This is it. It's not as simplistic as it looks here. So we have the fasciculi sitting back here with their nuclei sitting with them. This is where those posterior column tracts are going to be ending. This is where they're bringing those signals in. And then if we just continue one more slide, we now see the decussation in here, where the tracts are crossing over. We have the tectospinal tract sitting here. You know, it's in this area here. The vestibulospinal sitting above it. And we have all of these tracts sitting out here. All right? Vestibulospinal, spinal cerebellar, anterolateral, rurospinal, they're sitting there. You look at this. What color is it? Overwhelmingly, it's dark. All right? Same stains on all of these. We don't have a lot of nuclei in here. They sit here, here, a little bit in through here. This is just a funny view, but so this and this are the same thing. Okay. The problem when you do staining like this is sometimes you're a little bit off from being perfectly perpendicular, and so the tracts aren't quite the way you'd like them. But once again, in here, you have the gracile nucleus here, the fasciculi. So the gracile is a little bit inferior. Oh, except down here we have just the tip of the cuneatus. And we have the tracts. So I think what I've done on all of these is walk you through them, labeling what I expect you to be able to recognize. Okay? This is about the purest anatomy that you're going to do in here. I'm sorry about that, but there's no way around it. This whole area, the brain stem up through the base of the midbrain, is really critical. It is the area that ties together the midbrain and the spinal cord. So this area from here on up to here is really a critical area for tying together sensory inputs, motor responses, and everything to do with your levels of consciousness. So you've got those 5 sections. For Wednesday, try, I'll have you do a sample drawing of the first one we looked at. You remember with the superior colliculi and the basis and that, as I asked you to label it. All right? So try that on Wednesday. It's not for credit. It's just an exercise to help keep you in place. I think I have pared down, believe it or not, a lot of the information on this to get you going. Now, so we have a lot of stuff going on here. And an important set of structures and functions in this whole area has to do with the reticular formation. Here it is. It comes up and it does a shepherd hook up here. Okay? So we have the caudal reticular formation and the rostral reticular formation. The rostral is the part at the top that hooks around pointing towards the rostrum or the nose. So this is kind of that upper pontine area in through the base of the midbrain. And if you look at these sections coming through here, these sections you could compare to those other sections that were all sliced up that we just looked at. And you could see, oh yeah, here it is, here, here. I would not ask you a section like this and say, is that the caudal or the rostral? That's kind of silly. I'm not going to ask you about caudal and rostral reticular formation. I think what I'd like you to know is the reticular formation in general. In the brain stem, it is more posterior than anterior until we get up to the most superior part, in which place it hooks forward. So I think that's a good approach to looking at this. So the bigger question for you, and the bigger issue for you, now we're getting away from pure anatomy at this point, is what's going on here? What's happening? This becomes crazy, insane, in an effort to maintain your sanity. Norepinephrine, dopamine, serotonin, histamine, orexin, acetylcholine. These are probably the most important of the neurotransmitters in your brain. You have other minor neurotransmitters. This results in all of the major neurotransmission. Norepinephrine. And we are talking about projection systems within the reticular formation. We're not talking about anything else. Cell bodies in the pons produce norepinephrine. What do they target? Everything in the central nervous system. Alertness and mood elevation. Pretty much if norepinephrine levels go up, you're a little more elated, potentially. You're a little more alert, potentially. Dopamine. Substantia nigra, pars compacta, and the ventral tegmentum. Tegmentum. Oh yeah, that's part of that midbrain brainstem area. I remember that. Cool. What do they target? Striatum, the limbic cortex, nucleus accumbens, prefrontal cortex. Crap, that's a lot of stuff. Yeah, that's a lot of stuff. Dopamine. Dopamine levels are up in your brain. How do you feel? What?
Happy.
Happy? Good? Yes. As dopamine goes up, you're feeling pretty cool. Huh. Movement, initiative, and working memory in general. Movement. That's what I was telling you before. Okay? So now you have Parkinson's disease. What is that? What does that affect? Yeah. What? It's it can affect myelination, but it affects some specific stuff. Yeah?
Do you have an experience of like the dopamine secreting cells? Or there's less dopamine in the central nervous system to modulate the smooth muscle pathways?
And it's not the central nervous system. It is less dopamine, very specifically, in the projection systems involving substantia nigra. Oh, Parkinson's is a movement disorder that can also affect memory. It can affect behavior by affecting initiative. So there's a lot involved there. You're all going to have patients with Parkinson's. Hate to tell you, but you are. It's an interesting disorder that we do not understand. We know that there is a component involving head trauma. How do we know that? Can you give me any examples? Muhammad Ali, what did he do for a living? As a boxer. What was he known as a boxer? He was really hard to knock down. Now what does that mean? That means he was able to take punches. Oh, well he didn't get knocked down, but he has trouble talking anymore. And he shakes. I hate to tell you this, especially one of you in here. High level soccer players. Sorry.
I'm done now, it's all good.
You're done?
Yeah.
Okay, cool. High-level soccer players because of headers. Now you go, oh, how bad can it be to hit a ball with your head? You have never hit a soccer ball with your head, number one, maybe with one exception in this room. Number two, it hurts like hell. Okay, no, you get used to it, huh? Okay, I'm sorry. But you get recoil. There's no way around it. That recoil shakes your brain. So what they did was long-term studies. Concussion syndrome. Oh darn, NFL. I don't know if you saw the study that came out a couple weeks ago. They looked at, they took a sample of like 100 NFL players one weekend, and they tested them for concussion symptoms. 67% showed concussion syndrome. 67%. Ugh. Yeah. And then, of course, actors. What actor? Michael J. Fox. Okay? Nobody can figure that one out. Yes?
Isn't there some study about the show he was working on?
Oh, there is. Where was that show filmed?
Canada, something.
Vancouver. 3 actors from that show had early onset Parkinson's. Have early onset Parkinson's. I'm going for a weird coincidence, okay? Because as far as I can tell, Vancouver is just about perfect. I don't know about the rest of you, but...
Did you just go Vancouver?
No, I don't know. I've never been to Vancouver. Because if I went, I might not come back. So, yeah. Yeah, so dopamine. And memory. Memory pathways are interesting. We're going to talk a lot more about memory in a couple of weeks. All right. Serotonergic pathways, the midbrain, the pons, medulla, the Raphe nuclei of the medulla. We're going to look at the Raphe nuclei in the medulla. There's a whole bunch of them. And they all project to different parts of the central nervous system. Alertness, mood elevation, and breathing control. So, you're having serotonin issues. Is there anything that you guys might know about that have issues with serotonin? Any mood disorders that's treated with serotonin?
Bipolar?
No.
Depression?
Depression. That's a good one. Okay. SSRIs. Huh. People get depressed. Sometimes people that are depressed have breathing problems. They get anxiety, they have